At this time, we will go ahead and get started. Again, my name is Tencel Burke. I'm the Senior Marketing Manager here at Anytime Pediatrics, joined by three colleagues. Tashita Saunders, who is a Senior Sales Executive at Anytime Pediatrics, who comes with a wealth of experience in the pediatric sales space, including a stint at Office Practicum. Angie Connors is the Chief Operating Officer and one of the co-founders here at Anytime Pediatrics, who comes with a wealth of experience in the pediatric administration space. Eileen Foley, last but not least, is the customer support lead. She's probably spoken to some of you and helped you get onboarded and really in tune with training and the software here at Anytime Pediatrics. So at this time, I will turn things over to Tashita, Angie, and Eileen.
Thank you, Tencel. It's so nice to see everybody today or hear them. We're really excited to, talk to you a little bit about this, the virtual front desk, which is something that it's funny. Our current clients have asked us for a long time. So we're really excited to talk about it. I remember, over a year ago when people used to say, I don't know what I can see via telehealth. What if this patient is appropriate for telehealth? That triaging can easily be done visually with the virtual front desk. The virtual front desk can also engage in different clinical people in your office, whether it's nutritionists or someone else. And then you can route back to that front desk to do the checkout and the follow-up. So really, it's just an enhancement of what you're already doing in your practice, but it's adding the virtual part and it's connecting the telehealth part. So we're really excited to talk to you about this today. And I really just wanted to talk about this a little bit, because really the virtual front desk really keeps your patients at the center of care, which is the important thing that you always try to do in your practices. And the people who interact in the virtual front desk can really be whoever in your practice needs to have that video connection, whether that's the clinician, whether that's a licensed clinical social worker, a nurse, a front desk. But the other thing I always like to think about this, because I look at this from the practice manager perspective, is just because all of these people can be involved, it doesn't mean they have to or they always have to be involved. So I think that's the other thing to keep in mind. I always used to look at things that would be brought to me and think, how is that going to make my something that's going to hopefully simplify telehealth and simplify the workflows for your clinician. So why do we want to offer a virtual front desk? Well, part of it's really important for your staff. One is it's going to mimic the in-office visit, which is the experience your patients are expecting. That same amazing front desk person that greets your patients when they walk into your office can be the same person that greets when they check in for their telehealth appointment. It's an easy point of access to your practice. It provides that consistency. Think about how much more satisfying that experience for a telehealth visit will be for the parent. When they check in, they know their video is working, they know it's working on your side. It really gives that personal connection to your patients. And it's also really important to be able to have that virtual check-in. Think about how much easier it is to capture insurance, to get a picture, to say, I spend 5 minutes making sure everybody's in the right place. I can hear them, they can hear me. All that's done for your pediatricians. Also, the triage can be done, right? Like I mentioned earlier, is this patient appropriate for telehealth? Well, it can already have been triaged by your triage nurse. And it really can streamline the care for the pediatrician, right? Think of the time, how many more telehealth visits they could do if they really were just there to provide the clinical part and they weren't doing the tech support or they weren't talking about the follow-up visit. They were just saying, hey, I'm going to route you back to the front desk and they're going to schedule your follow-up in a month. So really, if you've ever heard me talk on a webinar, which is something I don't do often, I'm always about practice workflows, right? I always approach this from a practice management standpoint. And I really think that the reason the virtual front desk is great for practice managers and for the pediatric practice is the virtual front desk can be adjusted based on your needs, right? It's something that if you don't want your check-in person to have video, they don't need to do a video check-in. If you want it just to go on to the triage nurse and they're the only ones to do the video and then go to the pediatrician, that can happen too. There's just a lot of flexibility. And I think that flexibility is important because every practice is different, but I know in the pediatric practices, every day of the week can be a little different. Like Monday is a busy day, we're coming off the weekend, parents want to come in. right? So how I use that front desk might be different on a Monday versus a Thursday. The other reason we believe that the virtual front desk is important to pediatric practices is it makes it simple and very user-friendly for your patients, right? You want them to have a great experience when they visit your practice, whether it's in person or virtually. And the last thing is really your office staff can follow that patient through the virtual visit, much like they do in the office. You're going to see in our demonstration how this is color coded so that at any time your staff can look at a patient and know where they are. So it's a great way to kind of monitor your telehealth workflows so that you know where a patient is and you know that they're having the best experience they can with your practice. I'm going to turn it over to Sheeta, and she's going to talk a little bit about where the virtual front desk fits in with our two product offerings.
Awesome. Thank you, Angie. So talking about the virtual front desk, it's available in two solutions that we have within the Anytime platform. We do recognize each of your practices practice very different, and we want to make sure that we can accommodate and meet your expectations to seeing your patients during your telehealth visits. With that being said, at Anytime, we offer our Anytime Premier solution, which is your more robust solution for those practices that really choose to maximize their full use of the telehealth visits, with integrated virtual care and added workflows and sophisticated routing for your front desk to be able to administer their check-in process via video check-in, as well as the ability to route and reroute through patients. Utilizing the Premier gives them more access for your front desk to have reporting dashboards, and also really getting the gist of checking in your patients at the front desk and giving them more flexibility with analytics. Now, for those other practices as well that want that more simple, cost-effective, we do have that clinician-controlled, self-guided solution, which your front office desk and your administrators are still very involved as far as being able to schedule the visits and make sure that the patients are all identified for the appropriate provider to see. So with that expectations of our practices, we offer you the premier solution of the Anytime as well as your Anytime Go.
Great, thank you, Tashita. We just really wanted to show you the two offerings. The video check-in portion is only available in our Premier product. And I'm gonna stop my share so I can turn it over to Eileen, because we're gonna walk you through this virtual video front desk. So I'm gonna stop my share. Let's see if I can, there we go. And we will be turning it over to Eileen, who's gonna start our demonstration. And like Tencel mentioned at the end, we will just take questions and hopefully answer any questions you might have.
Perfect. Thank you so much, Angie. So my name is Eileen. I am a customer support specialist with Anytime Pediatrics. And right now I am on the Anytime Pediatrics platform with our web address, which is portal.anytimepediatrics.com. I'm going to log in now to my administrative account on the web platform. And right away, you can see that we have this pop-up that I received as soon as I logged in. Every single administrator or clinician will receive this pop-up, and it's a great way to make sure that all of your availability and notification settings are enabled or disabled, depending on what you would prefer, with each practice that you are attached to. I also have a preview to my camera and microphone, so I know that my camera and my microphone are working correctly. So when I do have a virtual check-in process with a patient, I know they will be able to hear me and see me. If your camera or your microphone are not enabled correctly, you can always click on this button here to go further into your account settings. So right now, this is the Anytime Pediatrics homepage. I'm going to go ahead and schedule an appointment for Chloe so she can pop into the waiting room for our demonstration. So the first thing I'm going to do is just search for Chloe by name. Once I locate Chloe's account, I'm just going to click on Chloe's name to be taken directly to her patient profile. And then on the right-hand side, I'm going to click Schedule Appointment so I can schedule her appointment for today. First, I will select the reason for the visit, the name of the clinician who will be treating Chloe, the date of the appointment, and the time. I'm going to save that appointment. And if you scroll down, you'll be able to see and confirm that that appointment has been added successfully to Chloe's account. If you need to make any changes, you could easily do so on this page by clicking on the edit button. So now that I've scheduled the appointment for Chloe, I'm just going to wait for her to arrive in my waiting room. So I'm going to go ahead and stop sharing my screen now so Angie can share the patient perspective.
Great, thank you, Eileen. So as she mentioned, I'm going to be the patient today. So you can see I'm logged in as a parent. I can see all my children. And because she just scheduled that appointment, when I log in, I've got a number 1 up here to show my appointments. So I also received a text reminding me of that appointment. You know, I know in practices, I always hear, if you can help me get the patient into the visit, you will save me so much frustration. So not only can I see it as a parent in my portal, but I also can receive a text message that 15 minutes before reminding me of that appointment. Your parents can be really on any device they choose. They can be on the web like I am. They can be on their smartphone, or they could be on a tablet. So I'm going to start Chloe's visit. The first thing I'm going to do is provide her weight. So Chloe's 50 pounds. I'm also going to upload a photo. So I'm going to go ahead and add that picture. Let's see, there it is. I'm going to add the picture of her rash. A parent can provide additional information if they choose, but really the only thing required is the weight. I might agree as the parent to your practice's consent to treat, and then I'm happily waiting in the waiting room to see my pediatric practice. So as I wait, I'm going to turn it right back over to Eileen.
Perfect. So now you can see that Chloe has arrived in my waiting room. As Angie had mentioned before, our waiting room is now color-coded. So Chloe's patient ID card in the waiting room does have that bright yellow banner around it, letting me as an administrator know that Chloe has arrived and she is yet to speak with anybody in the practice. So from the patient ID card, you can gather a lot of information. You can see Chloe, she's the patient for today, as well as Angie Connors, who is the account holder. And I can also see why she's in the waiting room, and that is for hives. I have her visit ID information and also the additional information that Chloe had provided before joining the waiting room. I can see how long she's been waiting to see her doctor, and I can also see who the appointment was scheduled for. So I'm just going to click on Chloe's name now so we can begin the virtual check-in process. Step number 1 is simply reviewing the patient's chart and the information. I can also see the chat history. If she had sent a message waiting for someone to reply, I would be able to see that right here. I can also take admin notes, nurse notes, or clinical notes before I start the video visit. To start the chat with Chloe, I'll click on step number 2. And as you can see, we do send an automated message letting Chloe know that an administrator is reviewing the details in preparation for the visit. And this is just a great way to let Chloe and mom know that someone will be with you shortly. To begin the virtual check-in, I'm going to click on step number 3. So as you can see, we have a nice large screen of Chloe in the front and center. I can make her full screen mode by clicking on this square icon on the bottom right if I wanted to get a close-up look of why she's visiting with the doctor today. The virtual check-in feature, it's a great way just to make sure that her camera and her audio is connected properly. So by the time she does see Dr. Miller for her appointment, he won't have any issues hearing or seeing Chloe. I can also click on this arrow on the right-hand side to view the image that Chloe had uploaded of her rash. I can continue to chat with Chloe throughout the entire virtual check-in process. Maybe I see her mouth is moving, but I don't hear her. I could use this chat feature as a nice way to troubleshoot with Chloe. For admin notes, they can be taken and saved throughout the entire virtual check-in process. So maybe after speaking with Chloe and mom, I know that the insurance is up to date, and I just wanted to make a note so I can save that for personal reference. So once everything is saved and I have all the information I need to get Chloe over to see her doctor, I'm just going to click Route Visit on the top right-hand side. And as you can see, Dr. Miller's name does default to the first person to select for routing since it was a scheduled appointment with Dr. Miller, but I can also route to other people in my practice. So maybe if I was a nurse and I did a nurse triage and I think there would be a different doctor that would be able to treat Chloe, I could always select them and attach a routing note letting them know why they were selected. So I'm just going to select Dr. Miller for this demonstration and also let Dr. Miller know that she has a headache and chills. I'm going to save that note. And now I'm going to route the patient directly to the doctor. As you can see, Chloe has went from yellow to blue, indicating that she is waiting to be seen by her clinician. If I hover over Chloe's name, I can see those routing notes that were also attached. So after showing you the virtual check-in feature from the view of an administrator, I'm now going to stop sharing my screen and hand it over to Tashida, who will be showing you the perspective from a clinician.
Thank you, Eileen. So I'm going to go ahead and take on the role for Dr. James Miller. And just to confirm, you guys see my screen now.
Yes.
And we have Chloe that is now highlighted in blue as a clinician. And again, if I just hover right over, I can see the notes that Eileen, my administrator, have captured in regards to the visit with Chloe. As I click on to Chloe's ID card and follow me over to the right-hand side, I get a nice step one of the review of her information for her visit details and account details. And what I would want to do is go ahead and start over to my next step over into the chatting feature. And this is a great option for me to go ahead and review all of the chatting communication that may have taken place between the parent, patient, and my staff and admin during this time. And as I prepare to go ahead and begin the visit with our patient here, step 3, once I go ahead and begin the visit, we'll be able to see our video image for our parent patient. And as you can see, there's our parent patient. There we go. Within the video input, to get acclimated to the screen. You'll notice across the top of the screen, the easy 5-step process for the clinician, and you'll notice the patient demographic information over in the top left corner. Now, I do want to give us a little bit more room of real estate to look at their chart information. So if you followed me over to the right-hand side, I'll just bring that arrow in so that now I have full view of the patient chart information as well. And you'll notice it automatically default to the image that mom and parent have already uploaded for us. So we're able to take a look at the image and begin our discussion with our parent for the visit. Now, as a clinician, I do have the opportunity as well to just review some of the administrative notes that I can see that they were checked in via video with my administrator up front. If my nurse did any triaging or communication, I have that opportunity to review those notes. But most important is if I'm capturing any of my notes, I can capture any of my SOAP notes here or any of my full detailed notes at this time. And my notes would be captured as well. Now, as I continue the visit with mom and I've reviewed images and captured any of my notes, I may suggest that mom go ahead and have a follow-up within 2 days. So as I have told mom that you're going to follow me up to the top of the screen where it says route and end visit. And this is where I will take my visit from my notes and things, and I'll route this back over to my front desk so that they can finish up the visit with our parent. You'll recognize the internal routing here to go straight to my front desk, and I'll actually give them a message to follow up in 2 days. So the front desk will know what to do, just as they would if they were in your 4 walls of your clinic. So now my front desk is aware that this patient needs to have a follow-up within 2 days, and I'm going to go ahead and route the patient back to the front desk. Now, as that communication has now gone over to the front desk, as a clinician, I'll go ahead and wrap up my part of the visit, and I'll go ahead over to step 5, which is just completing the visit. Now, as the visit is completed successfully, what's really important for my clinicians to see is your full visit details. You're able to capture and see the actual documentation for the date and timestamp and duration of the visit, which is very key and important, as well as all of the visit details and any notes and things that were captured. If something triggered your thought and you forgot to take a message or put in additional notes, this is an opportunity to capture additional notes. So that information will be stored as well for the patient's chart records. At any time you need to have any of this information captured into your current EHR solution, you can do a copy to clipboard, which will take all of this information as an attachment in a PDF that you can store over into your current EHR solution. As a clinician here, I am done with my workflow and I have routed the patient over to my front desk to begin their workflow. And I will now, as a clinician, hand it back over so that my front desk can go ahead and continue their visit.
Eileen, I think you're on mute. It's never officially a meeting until we say that.
Sorry about that. Thank you, Tashida. So as you can see, Chloe is right back in my waiting room, and she is highlighted in red this time, letting me know that the clinician has completed the telemedicine visit on their end. But since she's back in my waiting room and I can see front desk after James Miller, I know that I need to communicate with Chloe again, just to follow up with her after her telemedicine appointment. And if I hover over, I can see that Dr. Miller would like me to also schedule a follow-up telemedicine appointment in 2 days. So I'm just going to click on Chloe's name, click on step number 2 to start the chat, and step number 3 to begin the final process of the virtual check-in feature. Just refresh my screen real quick. Okay, there we go. So now that I'm back with Chloe, I can go ahead and communicate with Chloe and mom. We can plan what day and what time would be best to schedule the follow-up appointment. If in 2 days she's not available, we can always accommodate her schedule now that I'm face-to-face with her. I can also just ask any follow-up questions or answer any follow-up questions that they may have, in addition to making sure that all the demographic information and all the other information I have on file for Chloe and their family is up to date. Once everything has been completed, I can say farewell to Chloe and mom, thank them for joining using Anytime Pediatrics, and then I will just click complete and end visit to finalize this visit for today. Not only did the clinician get the visit details pop up, but I also do have that information as well as an administrator. So I can also copy this entire screen to clipboard and paste it directly into our EHR. I can also add additional notes if I would like to. But since everything looks good and I have everything I need as an administrator, I'm just going to close out of this box. And as you can see, now Chloe has disappeared from the waiting room. But if I go to today's visits, just another great feature that we have with Anytime Pediatrics, I could always go back to the Chloe's visit information if I needed to. Maybe after scheduling the appointment, I see that there's actually a conflict with the doctor's schedule. I could easily just call Chloe or call mom from the screen, and we could finish following up, scheduling that appointment. So today's visits is just another way to give you access to communicate with your patients. Well, that does conclude our little demonstration. So I'm gonna stop sharing my screen now and hand it back over to Angie for our Q&A.
Great, thanks Eileen and Tashida. We really appreciate the demonstration. You guys did, as always, an amazing job. You can see why we enjoy having them handle all of those for us. So let me, let's see, Tencel, do you have any questions in your part, or should we just open it up? I'm gonna let drive right now.
Thank you. Yeah, great presentation, guys. Very informative. We have had some great questions come through already in the chat, so please do feel free to use the Q&A portal or the chat to send any questions over. So Jennifer had a great question about using multiple devices to call into the same appointment. So for example, mom and dad are at work, child is at home, and absolutely, they can use our third-party invite feature to all join from separate locations into that same visit. And I'll kick it over to our panelists if anybody would like to expand on some other use cases or the use of that third-party invite feature.
Yeah, our practices, use that third-party invite for a couple. One is very obvious, like you said, dad's at work, mom's at home, or vice versa, and they want to have that appointment. They also use that to call in specialists, right? So sometimes, the patient is at home, but the clinician would like to add a specialist or a social worker to the visit. It can be done that way also. I know it wasn't a specific question, but one of the things I just wanted to point out too is that, as you saw today, we kind of continued around the circle. We went through that visit. One of the things we'll add as we continue to develop the virtual front desk based on your input as pediatricians is how do after it goes back to the front desk, maybe you use a social worker or a nutritionist or a lactation consultant in your office. If they're available for telehealth, would be the ability after they've come back to that front desk to route to another person in your office. So really, for some practices, there's, more of a clinical approach to some visits that are, a little more complex based on the child's needs. And so that's one of the reasons we're going to add that ability to route on to additional clinical providers. Looks like,
Yeah.
yes, go ahead, Tencel.
Yeah, so we had another question. Is there a way for a parent to communicate with a staff person while they are waiting on the next staff person or provider to speak with?
Absolutely. They can be, that chat function is available while they're in the different visits. So the reason we keep that chat function going is so we can keep communication going, right? So we know a lot of practices use that chat function to say, hey, Dr. Miller's running late. It'll only be 10 more minutes. Thanks for being so patient. That's really one of the reasons we keep that chat function going.
Another question about uploading images. So parents are wanting to upload a photo prior to or during the visit. Can they do it beforehand? And it looks like Eileen has provided a response. Absolutely, they can do it before joining your visit. They can also upload pictures during the visit. So maybe the patient or the clinician has requested or admin person has requested that picture while you're in the visit. Certainly the parent or patient can upload that image at that time. And
So
yes, go ahead, Angie.
Tencel, go ahead.
When adding a third party, can it be another parent? Absolutely. We often have parents joining from multiple locations. And so, parents are both at different locations, patient is at a different location. That is all certainly possible within the third party invite.
So I know this is a quick webinar and we've got a lot of questions, but I think the one thing I would say, and I love these questions, as a personal thing, I don't like it when there aren't questions, and I think these are fabulous. I would say to everyone on this, we really look to you pediatricians, practice managers to say, what do we need, right? The virtual front desk really came about because pediatricians said, I could really use this, or their practice managers or someone raised their hand. So really at Anytime Pediatrics, one of the things we feel like is, something that makes us the pediatrician's choice is that we want to hear from you. We don't just want to hear from you about, how things went today. Well, we do want to hear that, but we want to know how we can help make telehealth meet the needs of pediatricians. So we're certainly very proud of the virtual front desk because this is one of those really unique features that we feel like our pediatricians needed and wanted. So we love the questions. We love the suggestions for existing customers, from prospective customers. We always love to hear from our pediatricians.
Absolutely, and the virtual front desk feature was a feature driven by our current Anytime customers. So like Angie said, appreciate your comments, questions, and recommendations so much. And we will deploy a poll at this time to get a little bit more information about whether you're using a virtual front desk feature at this time, and if we can offer some assistance via consultation to help you explore those opportunities. Another question, and please do feel free to keep those coming. Can you add a third party from the phone app? And Angie, Dr. Hines says hello. Hi, Dr. Hines.
Glad to have you here.
And absolutely from the phone app. Go ahead, Angie. You want to speak to that one?
Yeah, you can absolutely add from the phone. I mean, I guess I need to clarify the question is, or if you're the pediatrician and you're doing the virtual visit from the phone, can you add the third party? I think that might be an Eileen question. I always do my visits or my test visits from the web. So Eileen, do you know if when the clinician is on the app, they can add a third party?
Yes, the clinician can add a third party to join using the mobile application. So they would just join and add through the visit using the clinician app, and they'll be able to add a third party to join the live virtual visit with the patient.
Awesome. Eileen is one of the experts. So if you're a current customer, you may have talked to her on the phone, and she is a phenomenal resource for all things anytime.
Wonderful, and thank you so much for your responses to the poll. Looks like we have about half and half, so it's changing as the responses continue to come in. So maybe most are not actually using a virtual front desk feature when conducting telehealth visits. So this might be a really great opportunity to really enhance the patient satisfaction and their connection with your practice. And we do have another opportunity for a webinar in May for Mental Health Month. Very excited to have Dr. Colleen Kraft, Dr. Barbara Perriard, and Dr. Barbara Howard of Chattis to join us on May 20th. So there's an opportunity to opt into that webinar via the poll as well. So please let us know if you'd like to join, and we will get you a free educational sign up to that webinar again on May 20th at 12 p.m. Eastern. So we are just about 5 minutes over the time today, but we really appreciate you all joining. Thank you for the great questions and for your interest. Angie, Eileen, Tashida, awesome job. Thank you guys so much for the wonderful educational presentation today.
All right. Thank you,
Thank
Temple.
you.
Hope everybody has a great Tuesday.
Thank you so much, everyone.
Have a good day.